And so, just to start, can you introduce yourself and what you do?
Yep. So my name is Jennifer Riley. I'm the Chief Operating Officer for Memorial Regional Health in Craig, Colorado.
Awesome, thank you. So, how are you doing right now with COVID? What are things like over there in Craig?
Well, things are not great here at all. We were in a bubble for quite some time, had very, very low case counts through most of the spring and summer. Starting around October 7th, we really started to see an uptick. On October 7th, we had a total of 45 cases to date from March to October 7th. And today, the numbers I just looked at were at 453 positive cases. We've had 19 people die in our community. 17 of those are from deaths due to COVID. 2 of those are people who died with COVID, but that was not their primary cause of death. It's really gone through our nursing home. Our nursing home had stayed very low case count as well. And then since November, I was just looking at some data. The number of deaths at the nursing home between November 20th and December 4th has been 8. So it's been really tough. Our community's been in disbelief, and it's not going well.
Wow, yeah, that's quite a difference between those two
Yeah.
points. How is the community reacting to it? Are they being smarter about what they're doing, or
No,
what are they doing about it?
nothing. They're not doing anything. Our county is in level orange. As of today, I think we're probably looking at moving to level red. We have, some of our local elected office officials, they're still meeting in person. They are not supporting the mask mandate, the statewide mask mandate. There's no local mask mandate. Our businesses are stuck between a rock and a hard place, wanting to comply, but getting, no support if they do comply. There are many businesses aren't. Their staff aren't wearing masks. They're not requiring people to wear masks. It's been tough. Our restaurants have done a little bit better. Some have shut down to in-person dining and just doing delivery and takeout, but they're not very receptive to any of this change.
Wow. So how is that affecting the hospital then?
Well, we're getting by. Our biggest concern is for staff and the number of staff. Back in March, we constructed a space in our hospital specifically for COVID positive patients. It's a negative pressure area. We can take up to 8 people back in that unit, 6 individual. We can double up 2 rooms, so we can take 8. We've had 7 people in that unit at one time. It's very, very taxing. It requires much more staff than just your regular med surg. So, we're monitoring our staff daily. We had to put into place some emergency provisions. We've had to cancel all PTO for the month of December. Make sure we have enough staff. We're approving things as we can, but we had to prioritize coverage for our nursing units in the ER and med-surg and COVID. We're having to pull nursing from our primary care clinics to the hospital side. So it's been very challenging. We do a daily update to our workforce and to the community on our social feeds about where we are with admits, where we are with staffing. We're answering lots of questions to try to bring awareness to the community that this isn't just something that's happening in bigger cities. And so it's been tough.
Yeah. What would you say are like the biggest stresses for you guys right now?
As the hospital,
Yeah.
definitely staff is our number one concern, keeping our staff healthy, it's one thing you can definitely provide a lot of safety for them when they're here in terms of PPE, but what they do outside of here definitely has an impact. We're probably approaching 15 or 20 staff members who tested positive since the beginning.
Wow.
Those have all been, we've done internal contact tracing. Those have all been infections acquired outside of the facility. So, I mean, it really does play a role in how we operate. That's a concern for us. We are still able to do elective surgery. That's for us key in terms of revenue. But again, we have to keep that department healthy to make sure, we can't do surgery if we don't have staff. So that's staff is our bigger worry now than than it was back in March. PPE was our concern back in March. Now staff is the new PPE. We have adequate PPE supplies. We have some shortages in little weird areas like gloves. We can't get size large gloves, but we're doing okay. We have N95 masks, we have gowns, we have face shields, and we're monitoring it, we're paying attention to it, but it's not as big a worry as it was back at the beginning.
Okay. Oh, that's cool. So with your staff, how is morale? Because like you said, like you had to pull PTO, so I imagine this is kind of just really heavy on them emotionally and physically. So how are they coping?
It's tough. I mean, I think some of them are getting close to burnout. We are mindful that you can't just work 7 days a week. Our intent in canceling PTO wasn't to keep people from taking, any time off at all, but we have to make sure that we aren't going to burn out all of our staff covering for PTO. So it's hard. It's very hard for the staff that are working back in the COVID unit, that are working with the patients who are dying. They're isolated back there. They work 12 and 13-hour shifts, just based on their time. And, that's a long time to be in one unit and, full PPE for that whole time. And it's tough. And, today we have 4 people admitted in the unit. That's still, that requires a lot of care. It's everybody's getting tired. Everybody is, in the ER, they're always concerned that the patients that they're taking care of are positive. So they are also taking a lot of precaution. But I think it's starting to wear on them.
So is there anything that like the hospital is doing or like individuals that you've seen do to cope with that extra stress that they're feeling right now?
We're bringing in some mental health support for our staff. We have some internal mental health resources that we can provide. So we're putting that together and making that available to staff to have that access. That's something we've seen done elsewhere, and we're hoping that that's something that will be useful here. We also have our Open Heart Advocates crisis support team. They're available and have been available for staff that we can have them work together.
That's good. That's really important. So I guess, how has policy been changing in health to meet this pandemic? And is it clear to you guys and to your staff, like these policy changes that have been occurring?
Like federal policy changes or
even local? Just like how has the way you work changed, I guess, is what I'm asking.
Well, for us, the changes have been, obviously wearing a mask all the time. Everybody in the facility has to wear a mask all the time. I'm in my own office, private office, so I'm not wearing a mask right now, but when if someone comes in my office, I do. That's been a big change. And visitation is a big change. We've really had to tighten up visitation. We only allow 1 visitor per patient per day. On the med-surg unit, no visitors are allowed back in the COVID unit. Typically, unless it's end of life, we do allow a family member to be with their loved one if that person is at end of life. That's been very, very hard. And it's hard to enforce it because you have a lot of compassion, and it's really hard to see someone be here. We had one of our own employees was a COVID patient for 22 days, and he couldn't have visitors, and that's really hard. And then that also puts a lot more emotional support burden on the staff, because they're playing that role too. So those are the 2 big changes that we've seen. We can't congregate, and even as staff, in our cafeteria, we've made it so you can't sit together and have lunch. That's a prime opportunity to spread COVID if you're eating unmasked with each other. And so cafeterias, all these tables with one chair. It's very isolating. It's very hard.
So this you kind of may have answered this a little bit, but that made me think of so like how have this experience challenged the maintenance of relationships?
Outside of work or inside of work?
Both.
Well, I think definitely the physical distancing that we're asking people to maintain is challenging relationships. You know, and that's, I think, been really hard for this community. They don't want to stop that. You know, they want to go downtown and have, you know, the gatherings at restaurants or gatherings for the holiday. We implored people to not gather outside of their single households at Thanksgiving, and that's a big change because that's not what we're used to as a community. So, I mean, it's definitely straining that. It's hard at work too, because again, you see people, you work with people, but you know, you're not seeing them socially, even at lunch or at break. You're really having to stay distant from them.
All right. So, how do you see this impacting the community in the future?
You know, I don't really know because our community isn't. I mean, I don't know. I don't know if they'll take. I mean, I think this community is going to be dealing with it a lot longer than some. I don't know that vaccine I don't think a lot of people here are going to be wanting to take this vaccine. They're very suspicious. So I think it's going to be difficult for us to get to that herd immunity. I think one of the only ways this community is going to navigate this is if we get access to rapid testing on a much more readily available basis, like we have with flu and strep, because it isn't working right now.
What are the barriers for you guys getting that? Like, what's keeping you
getting the supplies? You know, when it all started, Cepheid had a somewhat rapid test, a PCR test that could be done in an hour, and we had a supply of that we were using to test people in the ER that were going to be admitted. Then they said, oh, no, Abbott, Alere, the ID Now, that's the way to go. It's a 20-minute test. And we were able to get quite a few of those tests. We had like several hundred, and we were able to get more on allocation every week. So we were using that. And then they came out with, oh, by the way, you can't use that on asymptomatic people. They really should only be used on symptomatic people. So we were using that internally for staff, which we still can on symptomatic staff, but we can't get ID Now. We can't, there's no supply of that. There's no manufacturer of, and every time there's a new test that's available. But again, you know, that's not on contract for us or what have you. So it's a supply issue.
Wow.
Mm-hmm.
That's tough.
It's terrible. And we're not, I mean, it's not unique to Craig. I mean, you talk to any rural hospital, rural clinic, they're going to tell you, I would imagine the same thing.
Wow. And it's just like the distance it takes, or just context?
They're not manufacturing enough.
Wow.
I mean, that has not been a national strategy from the beginning to create, you know, rapid access to testing. That's not even in the cards.
That's frustrating. So from the beginning of the pandemic back in March, April to now, what do you feel have been like the biggest lessons that have been learned?
Well, I think for us, I mean, we've adapted very well and very quickly. I mean, I have been proud of how we've handled this and how we have leaders in the organization who are science-based leaders, and they look at what's happening. They look at the science, they look at the data, and then they make really good decisions for the organization and the community. They're not the easiest decisions, like requiring masks. We were early adopters of mandating masks. We were early adopters of restricting visitation. These are hard decisions that get a lot of backlash, but we've made them because they were the right decisions, and they were science-based, evidence-based decisions. So I'm really proud of that. And I think for us, we will continue to look at evidence and look at science when we're implementing changes. you know, we're operating under an incident command structure, and it's been no training that we do ever with incident command has ever looked at operational periods that were lasting 8 months, 9 months, 12 months. So it's really hard. And those are some lessons learned, like how are we going to shore up our incident command structure to last for an operational period longer than just a tabletop bus accident, it's been challenging.
That brings up a really good point. Like, how do you guys find that you're able to maintain this kind of like increased response for such a long period?
So
How do you maintain that?
about right before Thanksgiving, so whatever week that was, let me look at my calendar, when things were really getting heavy here. So around November 24th, we implemented a 24-hour on-site incident command and admin coverage. So, and we took our admin team, there's 6 of us, 2 work remotely, 4 work on site. So 2 of us are here from 5 a.m. to 1 p.m. And then there's some remote coverage from 1 to 4, and then someone from 4 p.m. to midnight. And then incident command, someone in the command center 24 hours a day, because we needed to be able to support our staff. So we added people to that incident command team. I think now they have 9 people that are rotating through that 24-hour shift. And then for admin, the 4 of us are rotating through those morning. 2 of us work the day shift and 2 of us work the night shift. And then we're just trying to be off when we're off, to preserve our own selves. It is hard. And we've had to figure out ways to meet some of our obligations differently, or get some help from others that aren't necessarily the people you would think of traditionally to handle those jobs.
Yeah. So how are you doing personally, like outside of the hospital and everything? How are you being affected by COVID and this new surge?
It's stressful. I mean, I'm not gonna lie. I'm highly concerned because our positivity rate is 1 in 5 in Craig. And it makes my family's here, so I'm okay. I have good days and bad. Just I think with everybody, but I'm getting by. I have a great husband, thank God. I have a lot of support at home, so that's helpful. And my parents are thankfully believers in the science, and so they're isolating and not going out. But we canceled our family Thanksgiving, and we're not having family Christmas, and so those are hard.
Yeah, I bet it's hard to miss family, especially around the holidays. This is a tough time when we're trying to ask so many people to be smart and stay away from each other, and it's Christmas time. It's a lot harder for that message to be accepted, I think.
It is.
So, I guess, do you have any stories that kind of sum up the pandemic experience so far?
And for me, it's for all of us, it's like Groundhog Day. Every day it's just it is just the same thing every day. And I don't know. I don't have any stories really there are some real tragedies in this community that, for us, we take very hard. We've lost, of the people who've died, 6 of those people were couples. So 3 husbands and 3 wives have all died. And I think that is just tragic, that people have lost both parents in, the span of just a few days each. And that's just such horror. But we see that, and I think we grieve that because, we're caring for these people, but then you have people in the community that are still talking about how this is just like the flu. And so it's just kind of maddening, but I don't think, that's not really a story. It's just a statement.
Yeah, so I think that's a really good analogy though, like comparing it to Groundhog Day. It's kind of just repetitive, just tragedy. So then I guess, Do you think this might change healthcare going into the future?
Honestly, I think we're going to stop wearing masks when we're caring for patients. And it's interesting, when the masks first came about, everybody was, I felt really self-conscious wearing a mask, like felt funny. And now I can't go, I mean, I feel funny without a mask. And I look at things like I was watching a TV show from like the 90s, and these people had the flu and others were just around them. And I'm like, they're not even wearing masks. But I think about last year, I mean, influenza season, we didn't wear masks when we went in to take care of patients and our doctors and our nurses. And I thought, oh my, it's just crazy to me that those are things that we didn't do. I think masks are not going away. I do think pandemic preparation is going to be something that's going to be part of our common vernacular for a long time. I think we had a pandemic preparation plan 4 years ago that got discarded by our current national leadership. And that left us kind of flat-footed because we stopped talking about that and we stopped preparing. I mean, my God, even when Ebola, I mean, I worked here at the hospital, what was that, 5 or 6 years ago, and we were preparing for Ebola. And, that only resulted in a few people in the United States, but we haven't been talking about it. I think we will continue to talk about pandemics going forward.
Yeah.
And preparing.
I really hope you're right. I hope this changes the culture of just how we act when we're sick.
I look forward to hopefully a more coordinated national message, because I think that's part of why we're struggling the way we are nationally. I mean, like, my community is always going to be a very conservative, right-leaning, anti-federal government community. They will. But for the most part, if you can coordinate a national message and say, this is real, this is science, I think it's going to help 70% of the population. And that's where we were with Ebola, right? I mean, we had a coordinated national message and preparedness message for Ebola. Even in Craig, we were practicing donning and doffing, and it was never going to come to Craig. So that's what I think is hopefully going to change.
Yeah, that'd be really good. I think that basically covers everything we wanted to talk about. Is there anything that you want to add, just to tell the posterity, tell the community for the future?
Well, I mean, it's definitely a learning. I was just thinking to myself the other day, like, what a time to be in healthcare. Like, in my millions of years, never would have thought this is something that I would be dealing with as an administrator in a healthcare organization, a pandemic that is this bad in this town. So,
speaking of which, like, how has this changed you, like, as a provider, having this experience?
Well, I think certainly it's made us adaptable. And I think I'm surprised at my ability to adapt quickly. And I think what it's made me be is more vocal about these are the things that we need to be doing, and advocating for myself and my family, or my community, whether or not it's heard. I'm trying to be the leader of it by example here.
That's awesome. Well, thank you so much for taking your time to meet with me.
Yeah, absolutely. Thank you very much for taking time to interview me.